Warahmatullahi wabarakatuh and good morning. Today I'll be presenting about the nutrition therapy for diabetes mellitus type 2 patient. So this patient is a 63 years old Malay woman. She was diagnosed with diabetes mellitus 4 years ago. She is a housewife and lives with her husband. She has a family history of diabetes mellitus from her mother and hypertension from her father. Her fasting blood glucose is persistently high with the range from 10 to 16 millimole per liter, and she spent 30 minutes early in the morning for gardening every day. The medical diagnosis for this patient is she had diabetes mellitus type 2. Her current fasting blood sugar is 16.5 millimole per liter, which is very high compared to the normal value ranging from 4.4 millimole to 8.0 millimole per liter. And her current HbA1c is 7.6 millimole per liter, which is also higher than the normal value. This is the diet diagnosis relation for diabetic patient. Diabetic patients should restrict or avoid intake of sugar sweetened beverages to reduce the risk of weight gain and worsening of cardiometabolic risk profile. As diabetic patients have higher risk of cardiovascular disease, they needed to reduce the intake of food with saturated fat and trans fat. The patient was currently on metformin and glycoside. Metformin and glycoside both are used to control blood glucose level. Metformin oral tablet is used along with diet and exercise to treat high blood sugar level, while glycoside is a type of medicines that used when diet weight reduction and exercise could not control blood glucose level. So this is the nutritional assessment for the patient. From the anthropometry assessment, we can see that her body mass index is 32 kg per meter squared. She is classified as class 1 obesity according to WHO 1995. Her biochemical data show that her fasting blood sugar is very high from normal, and also her HbA1c is also higher than normal value, and her clinical data show that her blood pressure also higher than the normal value. The dietary assessment data for the patient. From the diet recall, we can see the patient consumed sweetened beverages 4 times a day, and she also consumed a lot of sweetened dessert or kuih like kuih cek mek molek, tepung pelita, and curry puff. Her total energy intake of diet recall is 1847 kilocalories. Okay, this is the food checklist of the patient. From the food checklist, we can see that the patient consumed processed fruit juice once per day. Other than that, she also consumed sweet food regularly like honey, jam, and chocolate at least once a week. Overall, we can see that this patient likes to drink and eat sweet food and beverages. This is the nutrition diagnosis for this patient. First, excessive sugar intake related to frequent intake of sweetened beverages and food, as evidenced by diet recall, which show the patient consumed 4 times of sweetened beverages and desserts in one day. And the second nutrition diagnosis is excessive energy intake related to excessive consumption of carbohydrate, as evidenced by diet recall that shows carbohydrate intake was higher than the recommendation. Okay, move on to nutrition intervention. These are the objective and the principle for nutrition intervention. First objective is to reduce the blood glucose level of the patient to normal by educate the patient about diabetic patient and suggest the patient to choose food with low glycemic index and reduce the sugar intake of the patient by substituting sweetened beverages to plain water or coffee with no sugar. Second objective is to help the patient attain healthy body weight by educate the patient about balanced diet, suku-suku separuh, and portion control. And second, substitute high-calorie snack to healthy low-calorie snack like vegetables and encourage the patient to perform physical activity at least 45 to 60 minutes per day. And the third objective is to educate the patient on healthy eating by increase the vegetables intakes to 3 portions a day, increase the fiber intake to 30 grams per day, and eat meals on fixed time suitable with medication schedule. So this is the body weight and the BMI of the patient. As you can see, the BMI of the patient, she is classified as class 1 obesity. So her ideal body weight is 50.6 kilogram and her adjusted body weight is 58.7 kilogram. This is the energy requirement calculation for the patient. So from this calculation, I got energy requirement range from 1446 kilocalorie to 1550 kilocalorie. So this is the acceptance micronutrient distribution range by using 1446 kilocalorie as estimated energy requirement. I give this patient 56% of carbohydrate, 16% of protein, and 28% of total. So this is the recommendation and limitation for diabetic patient. Diabetic patients should not consume simple sugar more than 10% from total calorie intake. They also need to avoid trans fat and saturated fat as diabetic patient has high risk of CVD. They also need to increase their monounsaturated fatty acid and polyunsaturated fatty acid in their daily diet. They also need to increase the intake of fiber in their daily diet, and they should limit sodium consumption to 2300 milligram per day. So this is the exchange table to plan the menu for this patient. This is the first menu for the patient: breakfast, morning tea, and lunch. And this is the afternoon tea, dinner, and supper from the first menu. So this is the second menu: breakfast, morning tea, and also lunch. And this is the afternoon tea, dinner, and supper for the second menu. Okay, these are the practical tips for diabetic patient. Is 1, to eat non-starchy vegetables instead. And number 2, include food with fiber in every meal. Number 3, increase intake of whole grain food like oat, quinoa, and barley. And number 4, eat 1 or more good source of omega-3 fats every day. Number 5, avoid food that has high trans fat and saturated fat. Number 6, substitute sweetened beverages to plain water. And number 7, increase overall physical activity and avoid sedentary lifestyle. Number 8, diabetic patients should not skip or delay their meals or snack. Taking insulin or oral diabetes should be consistent about the amount eaten and the timing of meals and snacks. Okay, the nutrition monitoring and evaluation. First, we need to ensure the blood glucose level of the patient is controlled by ensuring the patient to follow the diet plan, substitute high glycemic index food to low GI food, educate the patient of carbohydrate counting when purchasing food products. And second, monitoring is to ensure the weight of the patient is reduced. Make sure the patient lost at least 0.5 kilogram per week. Educate the patient to follow suku-suku separuh and create a workout plan for the patient. And number 3, encourage the patient to practice a healthy lifestyle by making sure the patients avoid drinking sweetened beverages. Encourage the patient to snack healthily and reduce eating kueh or dessert. Ensure the patient does physical activity at least 45 minutes to 60 minutes a day. For the discussion, the patient was encouraged to choose food with lower glycemic index for their diet. A meta-analysis on low GI diet by Miller et al. 2003 found that low GI diet could reduce HbA1c by 0.43% more compared to high GI diet, and diabetes patients were recommended to increase their fiber intake daily, as diet containing 44 to 50 grams of fiber daily was reported to improve glycemia in diabetic patients. Next, weight loss were recommended for diabetes patient that was obese or overweight. 15% of weight reduction were found to be beneficial for diabetic patient. And the patient also recommended to increase her physical activity, as physical activity could improve glucose control and decrease insulin resistance. The conclusion for this case study is the main goal of this intervention is to reduce blood glucose of the patient in order to prevent any further complication. Therefore, patient was encouraged to choose low GI food and increase physical activity, as it could control blood glucose level and reduce the risk of complication. Thank you.